Now we shift to the acute phase, and remember, it's all about healing and infection prevention. We should start with protective isolation. This means strict hand hygiene and PPE. We should always keep burns covered and apply topical antimicrobials. But remember, most of these medications have sulfa in them, so we must assess for sulfa allergies. We should also immobilize and elevate skin grafts to prevent graft rejection and closely monitor for infection. So remember on NCLEX, infection prevention is a high priority in a client with burns. We must also maintain fluid balance. So how do we do this? We should closely monitor the hourly urine output. Remember, it should be greater than 30 mLs an hour. We should assess their daily weight and administer all prescribed IV fluids. And closely monitor for fluid volume overload because sometimes burn clients need very high volumes of fluid. Nutritional needs are also very high during this phase. This client is trying to grow back lots of tissue and skin all at once, so they are going to need tons of calories, especially from protein. Also, enteral nutrition may be needed if oral intake is not sufficient. And remember, pain management is still very important during this phase. We should administer IV analgesics and ensure that we pre-medicate the client with analgesics before any type of wound care or physical therapy. So now let's move on to the third and final phase, the rehabilitative or restorative phase, where the focus shifts to restoring function and quality of life. So we need to prevent scarring. We can do this by applying water-based lotion to reduce itching and apply pressure bandages to the burned areas. We should keep wounds covered and instruct the client to apply sunscreen if they must go outside. We should also focus on increasing the client's functional status with physical therapy, range of motion exercises, and splints. We want motion now so they don't lose it later. Finally, we should focus on emotional support to help the client adjust to these major changes in functioning and body image.